And I want to bring in Dr. Alok Patel from Stanford Children's Health. Dr. Patel, it was always expected that mask mandates would go away at some point. So is now the right time?
Well, Diane, it's not only not the right time, it's a little early, but it's not even the right manner in which these mandates were overturned. No one thought that mandates were going to stay around forever in public transportation. Just the leading epidemiologists of public health, people working on this, wanted to wait until at least that early May date so we could see what the rise in cases would truly translate into. We're not seeing a correlation in hospitalizations and deaths, which is a good thing, but we just wanted more data. And also, one judge in one day was able to overturn this mandate and cause places like Delta Airlines to all of a sudden call SARS-CoV-2 a ordinary seasonal virus, which it's not ordinary, it's not seasonal. So this strikes me as more of a political decision as opposed to anything rooted in science and data.
Now, how effective is it for those who aren't comfortable with this to wear a mask themselves? Can a mask offer protection if those around you aren't masked?
You know, it can. But there's two kind of issues with this. Number one, it's going to be a little less effective, obviously, according to previous studies. If you were to yourself wear a KN95 or N95, which you have to be fit tested for, which not a lot of people are. But also, Diane, I think about the fact that, you know, if you were on an airplane and they announced we're not going to be serving any peanut products because one person is allergic, nobody complained about that. So if you go on an airline now and you're like, my child is under 5 or I'm immunocompromised, everyone please wear a mask, you'd see a completely different climate. So it is kind of sad that moving into the next phase of the pandemic, the onus is on those who are most vulnerable to just protect themselves. And we can't expect society to all pick up and protect the minority of people, but it's sad that they're not even involved in the discussion.
So you said it yourself, professional healthcare workers get fitted for N95 masks. Regular civilians can't go ahead and do that. So what masks are most effective if you do want to protect yourself around other people who are unmasked?
It's going to be those masks, Diane, that have 3 levels of protection, even higher than a surgical grade quality mask. I mean, like a KN95. People just need to remember the old adage still applies. Fit and filtration is what you need to pay attention to. And if you're really worried about it and you're not yet vaccinated, you know what to do. Go get your shots. But you still have to take into account your own individual risk and what community transmission looks like wherever you live, because it's still high in some parts of the country.
Now, Dr. Patel, Governor Phil Murphy announced on Twitter this morning that New Jersey Transit is also dropping the mask requirement. But Philadelphia just stepped up masking, now requiring masks again in indoor public spaces. So how do you explain the mixed messaging here? Or is this based on numbers, or how are these decisions being made?
It's literally based on the mixed messaging that we've been seeing since March 2020, Diane, where different local officials are going to do what they want, and sometimes it makes no sense at all. But the one thing people shouldn't do is try to compare what Philadelphia is doing and saying that's why masks should be in place or shouldn't be in place in public transportation, because they're completely different. When you look at public transportation, you can't account for everyone around you, where they've come from, where they're going. It's completely different. If you're in a restaurant next to someone and they're coughing up a lung, you don't have to sit there with 1 foot away from that person on a bus like you would be on a bus or a subway for several hours of time. So this is very difficult for people to try to figure out what the next move is in the future. But I think the good news is we'll have a lot more data about what BA2's true potential is in just a few weeks, and hopefully some more clarity then.
Now, we have not had these mask mandates dropped in over 2 years, but when they were put in place, we also didn't have vaccines, and the variants were different than what we're looking at now. So based on all of that data, do you think we could tolerate a spike in cases without seeing these overwhelming impacts at hospitals?
As of right now, and I'm going to be optimistic and keep my fingers crossed, Diane, I agree with a lot of people out there in that we could tolerate another surge. We don't want to see another surge because that still means more illness, potentially more death. But our hospital systems, it's not like they've been restaffed and we have a lot more room. But you're right, we have more vaccine and naturally acquired immunity. If it's available for people, which that's a big asterisk because Paxlovid, Evusheld are not available everywhere, but people have more treatment options also. So that is good news. And you know what, even if you look at the data, we haven't seen a lot of localized outbreaks on airplanes themselves. So all of this strikes me as a big litmus test and to see how we're really going to do. And we'll find out in a few weeks.
All right, we will. Dr. Patel, thank you as always.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.